We will make sure that mental illness gets the attention it deserves in funding, research and technology investment.
I believe we can lead a revolution in mental health treatment in Britain.
We have to have equality of esteem in the NHS for mental health and physical health.
This government and the last one repeatedly pledged that the NHS should give equal priority to mental and physical illness.
Here we go.
But it's a promise that rings hollow to Beth Wilson, whose daughter Colby needs treatment for anxiety and low self-esteem. The 8-year-old is still waiting a year and a half after she was first assessed.
She's got so much worse. Her anxiety is just through the roof for the littlest and smallest of things. Standing in the playground, waiting on your child coming out, knowing that they're going to come out either upset or really hyperactive or just done in from the day, trying to keep it together is really difficult.
A new analysis of how NHS money is spent shows that while acute trusts, which run hospitals, got a 6.6% rise in funding last year, funding for mental health trusts only rose by 2.3%.
Funding at the moment is very tight in the NHS and there are choices to be made. Some of that funding is going to mental health, but there are really large pressures in other areas of the NHS, in particular around targets such as the 4-hour wait for A&E. So money's being passed to that area of care at the expense maybe of mental health services.
For the former minister who brought in the concept of equal treatment for mental illness, it's unacceptable.
I think that we should stand up and demand that the government corrects this awful discrimination at the heart of the NHS. That's what it is. People with mental ill health are experiencing discrimination in a publicly funded service.
For Beth, it just feels like such a false economy.
Without the support earlier on and early interventions, you're causing trouble and storing it up for down the line.
The aim may be to put mental well-being on an equal footing with physical health, but in terms of spending, mental health services appear to be falling further behind. Catherine Jones, 5 News.